Hi, I'm Jeanette Summerville and welcome to my channel, Everybody Wins. Today we're going to be recording a special episode. This is my mother, Genevieve, and she is recovering from a fall that happened a little over a month ago. So today's exercises that we're going to be talking about is how we can tailor exercises post-surgery, whether it's hip surgery, knee surgery, femur surgery, and we're going to customize them according to your body and your recovery because there are no cookie cutter exercises here.
They say it's kind of like a cookie cutter, that you gotta fit the mold. But I got something to tell you, no stutter. Try something new, don't stick to old. Then everybody wins.
So just a few things before we get started. First of all, every surgery is very individual. So you want to consult your surgeon and see what types of restrictions there are according to the exercises for your surgery. The second thing that we want to pay attention to is good nutrition. And sometimes it's very hard. You might not have an appetite. But in order for you to heal properly, you want to make sure that you're taking in enough water and making sure that you're getting healthy foods, even if it's in small increments. And the third thing is we're going to try to reduce our pain medication as soon as we can. We don't want to be staying on it for a long time, but we also do want to make sure that we're having it right before our exercising, maybe a half an hour or an hour before exercising, because if you're in pain, you're not going to be able to get the mobility that you really need. And lastly, mobility is so important. We want to make sure that we're moving all the time. So even if you're in your chair, you can be making circles with your feet. You can be trying to make the leg move in and out. You want to be walking as much as you can, or if you're lying down, there's exercises that we're going to show you that you can do while you're lying down. So let's get started. First of all, when you stand up, always make sure that you straighten your posture up. So even if it's a little bit stiff from here, we're going to stretch and try to open the hip flexors and stand nice and tall. As you begin your walking routine, try not to hold one leg stiff. At first, it may be difficult to bear weight on that leg, but with time, you want to make sure that both of the legs are functioning with knees bending. So let's walk over to the chair, and then we'll do some of our chair exercises. Take your time. Okay, great. And something worth mentioning, and this is why it's very important for us to pay attention to our individual bodies. Even though we did a great job, the rehab team that was with her did a really good job with her, there was something that they didn't notice as she began to walk. She was experiencing a lot of pain in her hamstrings. And so that was preventing her from walking well. And we needed to compress those muscles a little bit and do a little massage on them so that they could be released enough so that she didn't have pain. So always communicate that with whoever is giving you your rehabilitation. Okay, let's focus next on our seated exercises. Keep in mind that the exercises that you do, let's do them according to what feels good for your body. So you may change the order in which these exercises are done. Sometimes it takes certain muscles time to relax. You don't have to do them in a specific order. Do them in the order that feels comfortable. So you may notice, first of all, that one great tool is a foot bicycle. It's a very compact tool that you can use for the legs, and also it's very important to exercise our arms. So this type of machine can be set on a table so that you can exercise and strengthen your arms, since you'll be using walkers or canes, and that way you can also strengthen the spinal muscles. One of the tools that I like to have, you may not have at home, but if you notice it has wheels on the bottom, sometimes people even use a plant holder or a furniture mover that has wheels, but this is great for getting exercise very simply and pain-free for the legs. Just place the foot on top, and then you're just going to roll that to extension away from you first, and then you'll pull it towards you. Most exercises you should aim for doing 2 sets of 10 repetitions. And of course, it's good to give the other leg exercise also, because you want to keep both sides strong. If you don't have any of those, you can even experiment with a tennis ball or another type of ball and just put your foot on top and do the same motion. Another thing that I like to do with this ball that's going to strengthen the adductor muscles, that's placing the ball in between the leg, and you can do an isometric hold for 10 seconds. And if at first it's painful, you could do it for 5 seconds, or you can do again your 2 sets of 10. Go ahead, 1, 2, there we go. Squeeze. Open and close. Okay, very good. So another exercise that you can do is doing single leg marches. So we're just going to raise, four, 5, 6, 7, 8, 9, and 10. Good. And then, of course, we want leg extensions. So let's extend the leg out. And this would be important to make sure that you're keeping your foot flexed and your knee locked. And again, repeat even on the other side. Awesome. And lastly, we're going to make sure that we have mobility of the ankle and foot. So we can do circles with our ankle, go in one direction and the other direction. Very good. We can do some pumping action, extend and nice and slow. Good. And then when you feel you're strong enough, you can add some resistance to it. So you can have someone help you, or you can grab the band yourself. You're going to wrap that band tight around the foot so it doesn't slip. Give it a little resistance, and then you're going to press away. Push the foot in and out. Nope, keep the leg, yeah, and just press. Yep. Nice and slow. Back and forth. Excellent. All right, very good. So now we're going to do some exercises lying down. Some of them can be similar to what we did before, but you may find that as you're in your process of recovery, it's easier to do them while you're lying down. So again, it's very important to stress that you're going to do these according to your comfort. So you may have to change the exercises a little bit. For example, one of my favorite exercises is to make sure that you are getting the elongation of the hamstring muscles, which post-surgery is very important. So we'll bend this knee. Oops, bend this knee. Bend both up. I have a bolster under here. You can use a pillow, but we're going to keep one leg bent as we do these exercises. And we're going to try to aim to put the leg down, foot flexed, and press the knee all the way into the table and do some 5-second holds. So we'll press down, ready? 5, 4, 3, 2, 1, and relax. This may be very painful at the beginning, so you might want to start with other exercises that help you to loosen the areas of the hip, the knee, and the ankle. One of them that I like to do are just the glides to start. So you can do it with the mechanism that I had before, or you can do it with the ball. And then you're just going to roll that ball back and forth. Excellent. And then if you feel comfortable, you can start to do a butterfly position. So you're just going to take the knees in and out. Again, to your comfort. There might be a little bit of discomfort, obviously, because you've had surgery, but we want to make sure that we're getting all of those muscles, blood flow to the area, elongating the muscles. We don't want scar tissue to be forming around the surgical sites. Very nice. Okay, and then with time you can add some bands around the legs so that you can get a little bit more resistance. As far as the feet, again, we can do some foot pumps. So you're just going to extend and pull back. Extend, pull back. All right, now let's bend. Very important also is not allowing our glutes to weaken. So you can do some small contractions of the glutes. You can just contract one glute at a time, hold for 5 seconds, or do a pump counting to 10 seconds, okay? And you want to do that on both sides. The last two exercises that we want to do, one is very common and good for building up the quads and any type of rehabilitation of the knee, is that you want to extend the leg, flex the foot, and then you're just going to lift and do a set of 10, if you can, with the knee locked, okay? And 1, 2, 3, 4, 5, and we'll rest for right now. The other one is extending externally. So this one you have to be careful of. This is a little bit more advanced and you want to make sure that you're ready for this, but we're just going to extend that leg out just to where there's a little pull and then bringing it back in. Again, knee is locked, foot is flexed. Excellent. And if you notice, for comfort, we're keeping the other knee bent. The last thing that I want to talk about is don't forget that we're not going to neglect the upper body, because remember, our spinal muscles, there are stability muscles, they are connected to the hips. So it's very important in this process that you use little weights or bands. You can do some shoulder retractions, use weights to do bicep curls, to do flies or bench press type of exercises while you're laying down. But do not neglect the upper body, especially if you're spending a lot of time in the bed or a recliner. And remember, pay attention to your pain level. You don't want to do any exercises that cause you extreme pain. If you have any questions, you can leave a comment below. I know if you're watching this, that's because you care about your body. And remember, every body wins.